We
You're
can
on.
see you,
Oh,
Susan.
I am. Okay, great. Good morning and welcome to our fall program on youth violence and the criminal justice system. Our speakers this morning are King County Council member Girmay, and who is with the King County Regional Peacekeepers Collective, and Sean Goode, who is Executive Director of Community-Based Choose 180. I hope you were able to see the slideshow before our program began. The slides illustrate the devastating increase in gun violence and bear witness to the importance of the work being done by our speakers today. I'm Susan Simon. I'm the internal co-chair of Grandmothers. You all know Margie Heldring, who is the external co-chair. As internal co-chair, I lead all of our monthly board meetings and I work with all of our committees. The committees include communication and development, diversity and partnership, governance and nominating, legislative, membership, and program. You will hear updates from a few of these committees before we hear from our speakers. I do want to tell you about our newest activities, our show-ups. We're organizing these to increase awareness, to increase our visibility and to raise awareness of the increasing gun violence. Our first show-up was on August 14th, and 20 of us joined with grandmother groups across the country, grandmothers from Cape Cod and from Kansas, Missouri, for our first coast-to-coast grandmother show-up. There are pictures of our show-up on our website that you can see at grandmothersagainstgunviolence.org. We will continue to hold our show-ups on the 14th of each month to remember Sandy Hook, which was on December 14th. Our next show-up is this afternoon from 5 to 6 o'clock at the pedestrian overpass at 130th and Aurora. We will have banners and signs and we'll be wearing masks, and we invite you all to join us. Before we begin our program, the rest of the program, we want to thank Sunny Clemo for her tech work on today's program and Sarah Dean for her work on the slideshow. We also thank Maggie Carr and Jane Scriven for organizing and coordinating the program. And last but not least, we want to thank Cherie Rowe Proctor for moderating. It is now my pleasure to introduce Cindy Jackson, the chair of the Foundation Education Committee. Cindy.
Good morning. I'm Cindy Jackson, member of the research committee of the Grandmothers Against Gun Violence Foundation. The foundation raises money to end gun violence in our communities through supporting research that informs public health and safety policy. Today, I'm very honored to announce our 5th grant to the University of Washington and the first grant to the School of Social Work for $15,000. This research will be led by Dr. Jennifer Stauber and Taylor Ryan, her doctoral student, who sadly they are not able to be with us today because of previous commitments. But their research is important, especially as the month of suicide prevention that we know today is. This research supports the enhancement of the LEARN curriculum, a suicide prevention curriculum that has been developed and worked through the Forefront Suicide Prevention Network of the University of Washington. The enhanced curriculum that they are developing for parents will include an in-depth focus on lethal means safety and promote safe storage of firearms and medications in the homes. This curriculum is designed for parents, and this will be very relevant in today's world where firearms are increasingly accessible to youth. Through this curriculum, they hope to be able to give parents the information that they will need to be able to support their children in supporting and positive decision making. We look forward to sharing the results of this important research with our community in the near future. I'd like to introduce Jennifer Nolan Waldman, co-chair, Jennifer, of the Legislative Committee.
Thank you, Cindy. Good morning. We were pleased to see the issue of police accountability and its relationship to gun violence addressed through over a dozen bills in the last legislative session. While there have been some issues, as you've probably read about in the paper, about the implementation of a few of those laws, public statements from the legislators involved indicates that addressing the implementation challenges will be on the agenda for this session. Because this is the second year of a 2-year cycle, all bills that made it through the process last year are still alive this session, and other bills may still be introduced. However, our primary focus will be on the efforts to bring the high-capacity magazine ban to passage. It did not get a vote in the last session, although it passed through its committee hearings. We plan to offer an opportunity for anyone interested to join us at a later date to learn more about the high-capacity issue and how we might lobby effectively towards its passage. Now I'd like to introduce Cherie Rowe Proctor. Cherie is Vice Chair of the Grandmothers Association of the Internal Workings of the Operation and Chair of the Diversity and Partnerships Committee. Cherie?
Good morning and welcome to our program today. I am Cherie Rowe Proctor, and I wanted to just take a little time to say a few things about the Diversity and Programs Committee. In the beginning, the program was formerly called Diversity and Inclusion, but the name was changed to Diversity and Programs because if you have and support different programs, then automatically there's going to be some inclusion. Diversity and inclusion, we support different programs throughout the city, such as the urban gangs. We've also supported and reach out to families who have been touched by gun violence over the years. We send a sympathy card, which from Grandmothers, which was designed by our administrative member, Sarah Dean. And sometimes we actually reach out by phone and actually talk to the victims' families and comfort them as well. We also support various organizations in the community, such as Choose 180 and Community Passageways. Currently, our former chair and committee member at large, Winona Holland Higgs, has been working tirelessly with the Equity Now movement to rescind the Executive Order 9801. And that's just some of the things that we have been doing over the years since I've joined in 2018. Now, I am so excited to introduce our guest this morning, and we are just going to get right with it with our King County newly elected councilman, Girmay Zahilay. Born in the Sudan to Ethiopian refugees, he came to the United States when he was 3 years old, and his family settled in the Rainier Valley area in public housing. For a brief period, his family actually lived in a homeless shelter. But he graduated from Franklin High School, which is my alma mater, and went on to attend and graduate from Stafford and the University of Pennsylvania Law School, serving several years as a community organizer, co-funding the nonprofit Rising Leaders, and providing mentors for underserved middle schoolers. And as we all know, that's a very crucial stage in development. He was elected to the King County Council in 2019, defeated our long-term incumbent and beloved Larry Gossett. However, he is the youngest King County Council member ever, and that's an achievement. He helped in the formation this past June of the Regional Peacekeepers Coalition in response to the rising gun violence in the greater Seattle metropolitan area. And now, without further ado, King County Council Member Girmay Zahilay.
Thank you so much, Cherie, for that lovely introduction, and to be introduced by a fellow Franklin Quaker. What an honor.
Yes, sir.
What an honor. Thank you so much to all of the Grandmothers Against Violence. We appreciate you and all of the work that you do. It's more important now than ever. I'm Girmay Zahilay. I'm a King County Council member representing King County's District 2, which includes the University of Washington, Capitol Hill, the Central District, the Rainier Valley, South Seattle, and Skyway. And I just want to clarify really quickly that I'm not a member of the Regional Peacekeepers Collective. That is an executive branch function led by Zero Youth Detention and Derek Wheeler-Smith. But I am a representative of King County, so I can speak to it a little bit. I just didn't want to, take credit for work that I didn't do myself, but I'm happy to talk a little bit about that. One thing before I jump into talking about gun violence and public safety, I just wanted to point out a framework that I like to use to think about these issues. And earlier this summer, I wrote an article in the Seattle Times that documented this framework. The title of the article that I wrote in the Times was, "Let's treat gun violence like COVID-19." Let's treat gun violence like COVID-19. And I said that because, as everybody on this call knows, gun violence is a public health crisis. That's not new information. But what is new is the fact that the COVID-19 pandemic has provided us the template of what it looks like when our whole state and our whole country takes a public health issue seriously. When we take a public health issue seriously, it looks like what we've been doing with COVID-19. It does not look like our response to gun violence as a national collective, because we're not doing enough when it comes to gun violence. And we know it's a public health crisis because adverse childhood experiences, like seeing somebody get shot, can actually change the brain chemistry, scar the brain tissue of a young person, of youth, and thereby make it more likely that they hurt themselves or somebody else. So it literally can be transferred from person to person like a virus. And so we need to treat it like that. I will say that when I look at the COVID-19 pandemic, what I see most effectively about the strategy is that it's well-resourced, it's broad in scope, it's data-driven, it's collaborative with community, and all of our governments are extremely well-coordinated, very well-coordinated across the state, across the county, across the city. We're sharing information, we're constantly giving each other updates, we're telling each other best practices, we're coordinating from private sector to public sector to nonprofit sector, and we need all of that. We need that template from COVID in our gun violence response. We need our gun violence response to be well-resourced, to be well-coordinated across jurisdictions, to be collaborative with community, to be data-driven. And so I'll talk a little bit about King County's work that mirrors that template. And I'll say again that I'm not the person who has founded the Regional Peacekeepers Collective or even a part of it, but I can support it as a legislative branch member. And I'll also say that the things that I share under this framework are not enough. They are just the beginning. So I'm not going to sit here and tell you these are the things we're doing and this is enough and we're doing enough to solve this problem. No, a lot more needs to be done, but I'll share with you the work that I think is on the right track. So first of all, we talked about how well-resourced and far-reaching the scope of COVID-19 response has been. For example, we set up community vaccination clinics really quickly. We set up in that same way, we need to do that for gun violence as well. We need community support clinics where people can go whose lives have been upended by gun violence so that they can get rental assistance, mental health support, whatever they need to live a more stable life, because we know that somebody living, young people and their families living a stable, safe life means that they're less likely to participate in gun violence. And so that's why my office has been working on something called the Youth Achievement Center, For those of you who haven't heard of this, we're collaborating with multiple community organizations like Community Passageways, Creative Justice, Africatown Community Land Trust to work on a property in Columbia City that was owned by Sound Transit and develop it into a housing and resource center for youth. So young people ages 16 to 24, if their lives have been upended, if they are housing unstable, they need somewhere to go to live and get the support they need from people who have relationships with them. We're doing that through something called the Youth Achievement Center. And you can learn about that, more about that by going to youthachievementcenter.org. Again, to me, that mirrors the fact that through COVID-19, we quickly bought up properties and created isolation and quarantine sites to make sure that people can go and be safe and not transfer the virus to their family members. In the same way, the Youth Achievement Center can be somewhere where young people can go and have the safety and security and resources they need to develop into healthy young adults. So another thing that we did when it comes to COVID-19 is we transformed physical spaces to make it less likely for the virus to be spread from person to person. If you walked into a restaurant in the past year, you'll see plexiglass dividers, you'll see occupancy limits, you'll see people being masked up. We can take that lesson learned and apply it to our physical infrastructure so that we can limit the spread of violence. We know that there are organizations out there that are activating physical spaces to make it less likely that violence happens there. Organizations that are creating better lighting and music and food and having people who are trained in de-escalation tactics, activating spaces that are hotspots for gun violence in order to reduce the likelihood that violence happens there. Organizations like Southeast Network, Rainier Beach Action Coalition, Community Passageways, Urban Family. And one example is I partnered up with several of these organizations to address gun violence in the Rainier Beach Rainier Beach Safeway in the Rainier Beach neighborhood. Last year, I think that parking lot saw something like 12 shootings in 1 year, which is really bad and unacceptable. But we partnered up with these organizations, supported them, and organizations, especially like Southeast Network, who are on the ground in that parking lot, have led to dramatic reduction in gun violence in that parking lot. And so I think one way that we've been able to support that is my office led the charge on creating an amendment to the COVID-19 budget a few months ago to provide $2 million in support for organizations like that who are out there de-escalating, activating spaces, making it less likely for gun violence to happen in a physical area. So that's another thing that my office did in collaboration with community members. Lastly, I mentioned that our COVID-19 response has been super, in my view, well coordinated across jurisdictions. You see the state talking to the county, talking to the cities. You see public health department providing updates, not only within their own jurisdiction, but collaborating and sharing information and updates with other jurisdictions, even outside of the state, because we all know that our destinies are intertwined when it comes to the pandemic. Something that's happening down in Pierce County affects us. If there's a viral outbreak in Pierce County, we know it's going to travel up here. So we all are in this together. It's the same for gun violence. We cannot address gun violence in a silo. We know if there's gun violence in South King County, not only do we care about it because we care about all of our youth, for example, those are South King County youth, are our youth up in Seattle, are our youth up in North King County, but also because, again, our destinies are intertwined. Gun violence travels. And so we all need to be communicating with one another and being on the same page and sharing resources. And so I think the Regional Peacekeepers Collective, which is run out of Zero Youth Detention in the executive branch of King County, is a great way of coordinating across governmental jurisdictions, across the private sector, across the public sector, across the non-governmental, nonprofit sector. And that is just a great starting point to make sure that we're all on the same page, coordinating, building capacity of various organizations, making sure that an organization like Harborview, a hospital, which is on the front lines of gun violence and always seeing our young people transmitted there, is part of the solution and coordinating with us. That's just one example of an entity that you don't typically think of in terms of gun violence disruption, but if they are looped in and on the same page and sharing information and resources and at the same table as a broader coalition of entities, that is a great potential solution. So these are just a few examples that I shared, supporting community-based organizations that are activating space, the Youth Achievement Center, which is providing housing and support for young people, the Regional Peacekeepers Collective, which is doing regional coordination and capacity building, making sure that we have a unified regional response to gun violence. Again, we see with COVID-19 what it looks like when our region and our state takes a public health crisis seriously. And so we can mirror what was done with the pandemic in our public health response to gun violence as well. So our gun violence response needs to be much more well-resourced. It needs to be broad in scope. It needs to be data-driven. It needs to be collaborative with community groups, and it needs to be extremely well coordinated across jurisdictions. So just a few thoughts on a framework and types of things that we're doing in that framework. So thank you so much for the time and opportunity. I look forward to collaborating with everybody on this call. Thank you again for your work at Grandmothers Against Violence.
Thank you, Councilman, for your time this morning and coming to be on our program with such vital and valuable information. Our next speaker this morning is the Executive Director of Choose 180. Sean Goode is the director, and Choose 180 is a grassroots community-based organization that supports youth to make better choices for their future. Mr. Goode grew up in a challenging family in South King County, moving 12 times and went to 12 different schools. Now, as we all know, that must have been very difficult for him to navigate at such a young age, and especially during his teen years. But he graduated from Mount Rainier High School in Des Moines, spent several years of employment at the YMCA of Seattle, helping support young people to get jobs and, most importantly, to stay in school. He led a gang intervention team in South King County, also worked as a chaplain, and now he advocated for early education, and now, as the Executive Director of Choose 180, he wants to pay it forward by building supportive and healthy communities around our youth. The next voice you will hear will be Sean Goode, Executive Director of Choose 180.
Thank you very much, and I appreciate the opportunity to show up and serve in this space. I love Grandmothers Against Gun Violence. I have a special affinity in my heart for grandmothers, and the significance of centering the voices of our elders and not dismissing the wisdom of our elders. And as we work to build relationships in this space with the zeal and prophetic voices of our young people, I think that we are at our best when the wisdom of the old is combined with the zeal and prophetic vision of the youth, which allows us to co-create a future that not only can we dream of living in, but one we can execute on based upon the lessons learned from our past. And so thank you so much for creating this forum, for creating this space and the invitation to share a bit and to be on a panel conversation with my dear friend and brother and co-champion and a cause of eradicating the disease of violence in King County, Girmay, Councilmember Girmay. I'll be formal, Councilmember Girmay. As it was mentioned in the introduction, my name is Sean Goode. I steward Choose 180 as our executive director. think the most important things to know about me is, first and foremost, I'm married to the most amazing woman in the world. She's my gift from God, my angel from heaven, the love of my life, the woman of my dreams, the apple of my eye, the best part of every day that ends in Y, and I'm grateful. I also have 2 teenage children, a 19-year-old son who's going into his sophomore year at Central Washington University, and a 14-year-old daughter who will be a freshman, who is a freshman. Gosh, I would like to say will be, but is a freshman in high school this year. Also, I think not relevant to this conversation, but has some importance. I'm a big fan of dad jokes. I won't pepper you with any of them for the sake of time, but I just want you to know that that's hanging out there as well, that I love a good dad joke. So if for some reason when we get done sharing that any one of you want to hear a good dad joke and you put that in the question or answer box, I would feel so compelled to do so, and I'm more than happy to oblige. But we're here to talk about gun violence and this disease of violence, as Councilmember Girmay so eloquently stated and laid the groundwork for in this comparative analysis between what's happening in our most urban and under-resourced areas of our community and COVID-19. And we see it, it's explicit. I mean, in the first 6 months of this year, there was 580 shots fired and 42 lives have been lost to this disease of gun violence. It's clear. And year over year, we've seen it increase throughout our community. And let's not be deceived that this isn't an increase that can solely be tied back to COVID-19. This is an increase in a trend that we've watched continue to evolve, and an area that continues to be neglected at large. And it wasn't until the murder of George Floyd that finally folks had a chance to sit down, pause, be patient long enough to have an earnest assessment of what's truly happening in these communities that have long since been neglected. You had the murder of George Floyd, the sit down that the pandemic caused, and gentrification, which has not only pushed Black folks into neighborhoods throughout South King County that were historically suburban spaces for white people. So now white people are proximate to folks who have historically been impacted by gun violence. It's also pushed Black folks out of homes in the city of Seattle. And so when violence occurs now in these neighborhoods that have been gentrified, it's an awakening to those folks. And so it begins to surface as a broader issue that the community at large is beginning to cast a net of care about. And so we want to lean into a conversation about what is it that we can possibly do. And I've served the community in a variety of capacities, and many of which have been directly connected to working on this disease of violence, if not indirectly connected. And I have engaged in a variety of different programmatic solutions over that course of time. When I was serving at the YMCA of Greater Seattle, I helped launch a gang and group intervention team in South King County in the neighborhoods that I grew up in. As it was introduced, I lived in 12 different places in 12 years of school. I fortunately, because of public transit, was able to stay in the same school district for a good portion of that time. So, but we moved all the time, lease to lease. And so I lived all throughout South King County. So it was a great joy to me to be able to launch this gang and group intervention team. And I'll tell you, the work that we were able to accomplish over that period of time was transformative. It was significant. It was beautiful. And it didn't solve the disease of violence. We had people who served with lived experience, who engaged young people at critical moments, helped them reconsider the direction of their lives, helped redirect them, helped support them, resource them to be able to accomplish different things. And yet, the disease of violence still spreads throughout our community. I remember one morning in particular, I was serving as a minister at a church in Tukwila, while also serving in this capacity with the YMCA of Greater Seattle. And it was Easter morning, 2013. And the way this would work is that I'd get phone calls from the police chiefs or commanders in these different cities throughout South King County, and they'd activate me to a scene to tell me that there was an incident of violence. And we would show up to the scene, we'd begin to de-escalate the tensions, we'd work with the family, help demystify the moment and bring peace where there was in the midst of a storm. And it was Easter morning, 2013, I got a phone call because there was a shooting at a bar in Auburn, Washington, and 3 people were killed. Now I remember showing up on scene. This is 2013, and the white sheets were still laid over the bodies as they were in the parking lot early Easter morning. And the family was there, relatives were there, concerned loved ones were there. Yellow tape surrounded the parking lot, disenabling them from being able to even get proximate to their loved ones that were laid and covered in these white sheets. And the police were working the scene and gathering evidence and collecting information. And as we spoke to the loved ones and we spoke to the families, what was clear was this was a traumatic moment that everyone was experiencing and everyone was impacted by it. Not just those who felt the impact of the bullets tear through their flesh and eventually take their lives, but all of those that experienced directly or vicariously this moment of trauma and harm. And because the structure wasn't set up then and is still yet to be set up today to address the diversity of needs that come from the impact of a traumatic moment as such, the disease continued to spread from there, and it continues to manifest itself in variant ways today. And we're fortunate to live in a time where resources are being directed to be able to address this disease. And we have the Regional Peacekeepers Alliance and Dow Constantine and the council have got behind resourcing this programmatic approach to helping end this disease of violence. And the programs are helpful. The programs are significant, but I need all of you to understand that the core of my being, what I want to convey is that programming is just a stopgap. It is not a solution. Programming is a stopgap and it's not a solution. Now, that doesn't mean you should stop resourcing efforts that are producing programs that help stop the spread of the disease of violence or slow the spread of the disease of violence, because if you remove the dam, the water will just flow and all of us will drown in sorrow as a result of the many lives that will be lost. But what we have to begin to do is not just bring programming into spaces where young people and families are suffering generation over generation from the impact of this disease, but begin to change the material conditions that families are suffering from that serve as places that produce the very disease, that foster and cultivate the very disease that spreads and impacts Black and Brown communities throughout our region. Well, what kind of conditions am I talking about? Well, before we talk about those conditions, let's talk about the spaces where this disease does not flourish, where this disease does not spread, not in the same way. There are many affluent spaces that are proximate to quality healthcare, proximate to quality education, proximate to green spaces, proximate to sidewalks, proximate to grocery stores and clean eating, proximate to living wage jobs that you don't require you to travel on public transportation for hours at a time throughout the day simply to make it to a place that by the time you make it back home, you may or may not have a chance to work with your young people over their homework they may have or prepare a meal or share a meal. You understand what I'm saying? There's these safe spaces throughout our region that are held exclusive from the spread of this disease. They're quarantined in a way from being impacted in the same way. And the unique variables that are present in those spaces are absent and lacking in the spaces that our young people are presently living and dying in throughout our region. So how do we begin to change the material condition? Well, research is a big part of it. And I'm grateful that Grandmothers Against Gun Violence resources research, because we need not just the anecdotal to be able to tell you what it looks like, but we need to demonstrate it numerically so other people can ascertain what's happening in a way that allows them to internalize it for themselves and begin to live out their values so that we can begin to stop the spread of this throughout our region. That's one part of it. Thank you, Grandmothers Against Gun Violence, for doing that. But all of us, as citizens of Martin Luther King Jr. County, all of us as citizens of Washington State, all of us as citizens of this nation, and wherever you may be tapping in from around the world, need to feel compelled that if anyone is suffering from this disease, that all of us are vulnerable to this disease. Now I'm vaccinated and I wear my KN95 mask almost everywhere I go because I can't afford to get sick. And furthermore, I don't want to make anybody else have to suffer from the disease of the pandemic because of my carelessness. And so I'm constantly protecting myself, not just for me, but for those who I may come encounter with, and for those who they may come encounter with. So how do we as a collective us become equally vested in stopping the spread of the disease of violence, even if you live in a space that's quarantined from the suffering, if you're distant from the impact, if you're not the one with the loved one who's in the emergency room on the ventilator, if you're not the one with the loved one who has to stay home from school because somebody had contracted COVID, if you're not the one with the loved one or the sibling or the mother or the father who has been let go of work because they had to quarantine for 14 days, if you're not the one that's been directly impacted by the disease, how do we carry a shared empathy where we're still all working collectively to stop the spread of the thing? Because when I put a mask on, it's not just for me, it's for everyone else. And so when we translate this from the text, from the context around COVID-19, and we tie that back into gun violence, how do we compel those who are distant enough away from the disease of violence, but yet see the impact of it, to be just as vested as I am wearing my mask as they possibly can be in changing the material conditions that folks are living in? That means we have to start voting in a way that tells the story that we want to see in neighborhoods throughout our region. That means we need to start insisting that our tax dollars go to resource equity throughout our region. That means we need to start lifting up people in elected positions that not only see what's possible, but have lived the problem in a way that they can internalize the hope and begin to manifest the fruit of the labor in real time. Folks like Girmay, and the reason why he's been so transformative is because he grew up in the midst of it, can understand the impact of it. And because of that, he's been able to execute in a way that we haven't seen on the council in years. Family, I say all this to say that it's going to require all of us to change the material conditions that people are living in. Until the material conditions are changed, the spread of this disease will continue no matter how many programs we resource to impact it. There is a both-and approach that we can lean into together, and we can co-labor for a future that I believe we may live into, maybe not my generation, but my son, and maybe his children, or my daughter and her children may be able to live into a future where we're no longer talking about gun violence. We're no longer talking about this disease. I have a conviction that that's possible, in the same way I have a conviction that there will be a time when we're no longer talking about COVID-19. But it's going to require all of us. Those of us who are vulnerable to the spread of the disease, and those of us that are distant and have had the luxury of living apart, quarantined in a way from the disease itself. Grandmothers Against Gun Violence, thank you for the space. And I hope that by ending my presentation at this time, it leaves an opportunity for questions from the folks who are so generously committed to sharing space with us on this morning.
Thank you, Sean. That was such a passionate delivery on the subject of gun violence as a disease. And I've especially appreciated you saying that programs are a stopgap, but not a solution. And also thank you for supporting grandmothers for our research, because we rely heavily on it. I appreciate that acknowledgement. Now we've come to the part of our program that is question and answers. And our first question is going to go to Councilman Girmay. And it is, why aren't all shootings required to be reported to the news by the police? Why aren't all shootings required to be reported to the news by the police? I don't know if you can answer that, but.
I don't think I understand the question fully.
Yeah, that's why I repeated it twice.
Why aren't all, I think that begins with the assumption that, yeah, I guess I just don't know enough about that. I don't know what requirement there is or lack of requirement there is for reporting shootings to the news.
Mhm.
May I share?
Go right ahead.
Yeah, I can't speak to the requirement about what needs to be reported to the news, but I can tell you that the way that the news reports shooting can at times be deeply problematic. And I've had conversations with the Seattle Times in particular about this because so often when the information isn't clear, or there's misinformation, or the story is only half told, it begins to paint a narrative about particular pockets of our community that can be not only stigmatizing, but deeply problematic and perpetuate racism as a reaction when it's simply a disease that some communities are more impacted by than others. So I also think it's not only making sure that law enforcement is conveying information to news media outlets, but holding news media outlets accountable to telling the whole story of what's happening and not only giving partial truths, snippets at a time, and hoping that people are following the continuum of the narrative. An example is if there's a shooting in an area and they report on the shooting, but the follow-up coverage comes later, and then even more later, some people are no longer tracking that narrative. They're simply saying, well, that's a dangerous part of the town. We can't go there because shootings happen there, without understanding all the other conditions that were created in order for that shooting to manifest itself. So I think that making sure people are aware of when violence is occurring is important, but I also think it's imperative that we filter through what's happening through a lens of understanding why this is spreading and not just that it is.
Thank you. Thank you. The next question is, why aren't all firearms restoration hearings be required to notify and invite the survivor of the shooting to be at the hearing and allowed to make a statement as to the disposition of the firearms?
That's nothing that I'm familiar with. I don't think I can contribute to that question.
Same.
That seems like that's a legislature question, I would think. And then I've gotten 3 requests for a dad joke.
Okay, I'm more than happy to oblige. Why is it that you can't hear the pterodactyl use the bathroom? It's because the P is silent.
Good one.
That is good.
Good one, Sean.
Oh, that's wonderful. To lighten up things just a little bit. Okay, the next serious question. How do we get a shirt, hat, whatever, that has Protect Black Youth logo on it?
I will see if I can drop the link in the chat box to the place that I got it from before this our time is up.
Okay. Okay. Is there really any place in King County that hasn't experienced gun violence? It's a good question.
I think absolutely gun violence manifests itself in a variety of different ways. I think about how my father pistol whipped my mother, which led to us leaving him and beginning a journey outside of that home. I think about my uncle, who was recently, recent within the last year, was killed by police because of a domestic violence incident that may have involved a gun. I think that when we talk about gun violence, it shows up in domestic violence, it shows up in gang violence, it shows up in a variety of different strains of violence. And so is there a pocket of the community that's not impacted by this disease of violence? Absolutely not. But the caveat I'd add is there's plenty of places throughout the county that don't go to sleep at night worried about gun violence, who aren't worried about if gun violence is going to impact them. And you can see the correlation between that and any other disease, where there's pockets of places throughout our region that are much more susceptible to the spread of COVID-19 because of lack of folks who have chosen to get the vaccination. And so in those spaces, you're much more vulnerable to the spread of the disease of COVID. And there's certain spaces throughout our community because of the socioeconomic conditions and the intentional divestment from those spaces that leave them more vulnerable to the spread of gun violence. And when people are in those spaces, they're much more aware and cognizant of the fact that they could be impacted by this disease. So is there a place where that's not been impacted throughout King County? Absolutely not. And yet and still, there are places where people aren't constantly thinking about the trauma that they've encountered as a result of being a victim or being accused or being somewhere associated by this disease of gun violence and violence in general. So I think that yes, every place has experienced it. Not every place is experiencing it, is the best way I can answer that.
Okay. We'll take a couple more. We have some time. Councilman, how has the reduction of the Seattle police force affected the community you serve? And what is the coalition relationship with the police in terms of policing reform and tactics?
Do you know which coalition they're referencing?
I don't.
Okay. Maybe if somebody wants to clarify that later on, I can answer that one. For the first question, how has Seattle Police Force reduction affected the community that I serve? I think that's a difficult question to know. I don't really know, there hasn't been a comprehensive assessment that I know of that has tied reduction in police force to how people in my community are, what impact that's having in the community. I know very clearly the trends around the country are clear because of COVID-19, because of the anxiety, because of the poverty, because of the job layoffs, because of the isolation, because of the lack of outlets where people used to go to address some of their frustrations being closed. All of those things have led to an increase in homicides in many different cities. And I wouldn't tie that to a specific, reduction in police force, since that trend is across the board in all big cities that we're seeing. I did see a recent analysis by an organization, is it called Third Door or Third Way? I can't remember what the specific organization is called. They just released it, but they saw no increase in homicides or crime associated with police reforms. They haven't seen that. So the people who are saying that a recent wave of police reforms are responsible for increased homicides in cities, that the data just says that's not true. What is behind it is a lot of the increased poverty we're seeing, a lot of the increased anxiety, closing all of the outlets that people used to have, job layoffs, all of those things, of course, lead to increased homicides. And so we do need to address all of those things, the things that Sean was talking about, making sure that the material conditions that people live in are addressed. And so again, building off of Sean's point as well, of course, there's no pocket in our community that's not impacted by gun violence. If we're talking about the kinds of gun violence, which is, young people shooting other young people, that is highly correlated with how impoverished or under-resourced an area is. When I ask the prosecutor's office or the police department for a map showing incidents of that type of gun violence, young person on young person, it's almost the exact same map of how under-resourced an area is. You could superimpose them on one another and it would be the same map. So again, those material conditions, making sure that we have a region that supports everyone and that every child born in King County has a great chance of living a healthy, safe, housed life. That's really what we need to aim for.
Okay. Sean, with most young people spending a great part of their day in school, do you know of a school that has implemented an effective outreach to vulnerable youth?
Yeah, thank you for the question. Here's we often put so much on educators, kind of like we do on law enforcement, right? So we're asking people who have a particular scope to do a whole lot of things that are outside of their scope. You know, it's kind of like if you got a friend that's a doctor, right? And then all of a sudden that friend becomes a specialist about everything, right? With the moment that you feel like you don't want to Google or WebMD something, you're like, oh, I'm going to call my friend. Like I got a friend named Rachel. She's one of the leading gastroenterologists in our region. Absolutely brilliant. And I hesitate sometimes when I got to go to the doctor about something. And I'm like, well, should I call Rachel first? That's not even her specialty. But like, you know, I mean, she has to know something about it, right? And I think what I see is certain schools, I'm going to tie it back to the question. I sometimes like to go on tangents, and this is just another one of those. But what I see often in schools, it's an excuse for me to brag about my friend Rachel, who's a brilliant gastroenterologist more than anything else, and a Black woman, mind you, a brilliant Black woman gastroenterologist. Let's celebrate brilliant Black women today. Another side, but what schools do well is when they partner with other organizations that can do the work that they're not specialists in. And so we operate in Highline Public Schools, and we're going to begin to partner in the city of Seattle as well to offer an alternative to suspensions and expulsions for young people who would otherwise be headed down that path. And that collaboration allows the school to do what they do well and allows us to do what we do well. And together we're able to serve our community well. And I think those are the best strategies. The more co-laboring we do, working together for a common cause, the farther we go than wanting everybody to be the specialist in all the things.
Okay. Who can we connect with to support members of affected communities in running for office?
Is that, can you read that one more time?
Who can we connect with to support members of affected communities in running for office?
Oh, that's a great question. So I this year started an initiative called Build the Bench, which recruits and helps people from marginalized communities run for office. You know, really paint the picture of what it looks like to run for office, what resources you need, what the step-by-step guidelines are. And we've had 4 workshops so far this year in which young people from schools like Rainier Beach and Garfield and Franklin or Cleveland come on and learn about how to run for office. So I'm more than happy to connect with anybody who wants to support young people from low income or marginalized backgrounds, underrepresented backgrounds, running for office. That's something that I'm passionate about, and I would be happy to plug in with anybody here who wants to support that.
That question came from one of our diversity and programs committee members.
Awesome.
I would also just quickly add that please read your voters pamphlet and watch the voters videos and make informed decisions based upon the information that's provided. Being able to do mail-in ballots in our state allows you to sit at your dining room table and really intentionally research the people who are running and find out information about where they're coming from and advocate for them amongst your peer groups and the people who you're most intentionally connected to.
Well, I think we have time for just one more question. Can either or both speakers talk about the Seattle Safe and Thriving Communities Division within the city's Human Services Department? How do they work with them?
Unfortunately, as a King County council member, I'm not familiar with that program at the city.
I can say that it's a brand new office at the city. And I think they just recently hired their director for it, or they've been in the hiring process for the director. And as an organization, we're excited about what possibilities we can create together, but haven't had any experience working with them yet. That was a really anticlimactic last question answer.
Yeah, well, I think we have just time for one more then. Are there accurate and available statistics on gun-related deaths and injuries by city, county, and state?
Yeah, for the county, yes. And I will drop a link to an article I wrote in Crosscut recently that links to it. I'm not doing that for a shameless plug to the article, but because I looked up that article before our presentation today, to just pull some of the data points that I called out, and there's links in there to some of the county-wide data. I will also say that I sit on the Partnership Council for Juvenile Justice for the state, and statewide data is much more complicated because not everybody collects things the same way or tells the story in a way that's equitable.
And Councilman, I'll let you have the last word.
Yeah, I co-sign what Sean said. There is county data, and I also linked it in my article that I referenced. Yeah. But if you have Sean's, you should be good to go. I'm sure it's the same link that we both used in our respective articles.
Okay. Thank you, gentlemen. I want to we really appreciate both of you coming this morning and spending time with Grandmothers Against Gun Violence. We were so happy to have you share your knowledge, and we look forward to collaborating and working with you in the future. And we just are just excited that we have such enthusiastic people in the government working towards our current issues in gun violence. And Sean, you are a jewel and so passionate about what you do. It's just well appreciated, everything that you do have done in the community. And we're also looking forward to you, Council Member Girmay, as to what you're going to do in the future as the King County Council member. And if there is not anything else for us today, I think we can wrap it up. But let me say, Grandmothers Against Gun Violence is on the scene. We've been a force to reckon with since 2014. And our motto is we always show up, stand up, and we speak up.